Okay, my name is Sharon Lim. I'm from Sandakan, Sabah. Welcome everyone. Thank you for joining us tonight. Okay, all right. Our first session, sharing on hormone was very successful before. So tonight sharing is about cortisol and DHEA. But I'm not the speaker tonight, so I will welcome our speaker. Our speaker tonight, health coach Kim, to share about cortisol and DHEA. DHEA. Welcome, Kim.
Okay, thank you, Sharon. Okay. Wait. I need to do this first. Alright, hi, welcome everyone, and good evening. Just a little reminder, please mute your microphone in order to not to disturb other participants. So if you have any questions after I've done my presentation, you can just ask me through the chat room, or even later you can unmute yourself and ask questions. So thank you for spending at least an hour of your time with us today and learning more about the functions of hormones in our body. So I also like to take this opportunity to welcome who have attended my previous session, and also welcome for all the new participants today. And I also like to wish everyone Happy Chinese New Year, because now it's still New Year time, and wish you a blissful and healthy year ahead. So for those who do not know me, I am a certified health coach who has been working at least 6 years of my time serving patients and also customers, which is under the care of preventive healthcare doctors or practitioners. So with all the past experience, I have encountered that learning the roles of hormones in our body is very important steps towards recognizing when they are not working right. So moreover, understanding how certain hormones affect each other can provide another important piece of biological puzzle in our body. So once you have the right information, you can provide another able to identify which hormones are out of balance and take steps to remedy it. So this is the outline of the topics today. So it will be the reviews on the hormones, which is I've done on session 1 before, and which are what is cortisol and DHEA, what are the functions of cortisol and also DHEA, and how cortisol or DHEA to be tested, and also what are the symptoms, which is if you have high or low cortisol or DHEA, what are the symptoms, and lastly is the case study for it. So first, just to recap on our previous sessions, the hormones are actually a chemical substance that act as a messenger between cells that carries the signals and inform them what to do. So how our body knows when we should replenish our own hormones. So this is when the hypothalamus, which is a form, from one part of our brain, sends a signals within our endocrine glands that says that certain parts of our body is lack of the hormones, and they will start the productions on your glands and being transferred to where it's lacking. So next, the hormones are all derived from the cholesterol, which is here, and also circulating LDL particles in the bloodstreams. So cortisol is made in the liver and then is used to make pregnenolone here, which is primarily the master of the steroid hormone. So pregnenolone is the master of the steroid hormone, which produce all these hormones here. And without adequate cholesterol or even LDL, the steroid hormone production can be significantly impaired, which is might having problem. So today we are going to dive into the individual hormones, namely cortisol and also DHEA. So first we look at cortisol. So cortisol is produced in the adrenal glands, where it is known for the relationship of stress. So it is released in the reaction to dangers and initiates the body fight or even flight response. In other words, cortisol prepares the body to fight off a predator or run away from it. So for example, you were to come face to face with your crush, which is the one you like or the one you love, and no doubt your cortisol level will soar. It will then stimulate an increase in blood sugar and fatty acid levels, blood flow to muscle, strength, blood pressure, your heart rate, and contractility. So your pupil, which is your eye, will actually be dilated, and there is opening of airways. So that is the reason why when you meet someone that you really love or idolize, you can't find the words or you can't even know how to talk to them, because you just can't. Your airways are open and your mental activities are very complicated that time. So all this happen, you can either just man up just jump over all these things happening in your body and just talk to the girl or boy, and either one is just that you just turn your back and act as if you're doing something more important, which is what we usually do, right? So it's like staring at the wall, but actually you're just scared. Okay, and next is that what are the functions of cortisol? So the functions of cortisol is that the cortisol influences is meant for the other acutely stressful situation like dehydration, injuries, infection, low blood sugar level, or even injections of toxins. So meaning if you have too much toxins in your body, it will also have this kind of problems, which is you have high cortisol on that. Although these hormones helps to block the sensation of the pain during a very stressful situations. So if you like going for competitions and someone hit you or bruise you or even cut you, for me, I'm a fencer, which is I'm doing fencing in here, Malaysia. But when I do competition that time, when someone whack my fingers or even some part of the body, I won't feel pain because that time my stress level is focusing on my competition that time. So after the competition, I will feel all the pain and even bruises. Then I will notice that, hey, when I get this bruise or when do I get this cut? So cortisol will actually block the sensory pain. So you won't feel pain after you try to relax your body. So this is why during that time you will understand that when high cortisol you will feel pain. Okay, so other than that, aside from its role in stress reaction, cortisol influences mood, thoughts, weight, bone density, the immune system, protein production, hormonal balance, and fetal development. So it is such an important hormone. In fact, life cannot live without cortisol. So cortisol levels are normally at their highest, okay, in the morning. So you can see here is that they are very high in the morning, and after that they will slowly deplete accordingly to the time so that we can go to sleep. So after that, your cortisol level will rises again so that it will help you to wake up. Okay, so interestingly, while the production of other hormone tends to decrease over time, cortisol levels actually tends to increase with age, particularly if you lead a very stressful life. So the truth is that the modern stress comes from family issues, work, finances, chronic diseases, and other pressures. So the problem is that cortisol does not differentiate this stressor. Whether the stressor is a real emergency such as a car accident or a perceived one such as worrying about what someone thinks of you, the body response is just the same. Because modern stress affects the body daily, then the stress reaction can become chronic. So unfortunately, the body does a very poor job of managing chronic stress. Over time, with this chronic stress can have a negative effect towards your adrenal gland because it's working so hard, and with all the stress, it keep on working and make sure that you don't have high cortisol. But because of this daily stress and daily impact from your environment and what you experience, it can lead to hormonal imbalance or something we know as adrenal fatigue syndrome. So today, the fast-paced and heavy demands of work life, family life, and social life had put excessive stress on many individuals every day. So instead of producing cortisol to handle a quick burst of stress and then going back to normal, the body makes more and more of this hormone to deal with these constant worries and pressure. So as such, cortisol level will remain elevated throughout the day. So you can see that after the production, it will try to preserve some of the hormone production in a back burner because it will create further hormonal imbalance. So imagine you keep on suppressing, and it actually is not in use when it is needed. So it will create hormonal imbalance as well. So here is that many harmful effects are associated with chronically elevated cortisol. So remember, the cortisol's job includes ensuring that every stores are ready to use on demand in the face of danger. So this will increase the glucose and fats in the bloodstream, which if allowed to stay elevated, it can lead to diabetes or insulin resistance as well as high cholesterol. So unfortunately, where is glucose best absorbed? Which is in the fat cells. And where is fat cells are most abundant in is at our belly, which means that chronically raised cortisol can also increase waistline. So cortisol also often steals protein from muscle. So in order to make more glucose, it will result in loss of muscle as well. So this is quite serious if you have a very high cortisol problem. So here are the symptoms of high cortisol, and if you have more than half of these symptoms, it is likely that your cortisol production is elevated to an unhealthy degree. So if you wanted to take a snapshot of this, you can take a snapshot. So if you have more than half of these symptoms, then you might have problems with, not saying that you will have high cortisol, just that you have the symptoms of having high cortisol. So I will tell you later how to check on whether you have high cortisol or not. So unfortunately, if cortisol can remain elevated, it can lead to an entirely new stage of illness called adrenal fatigue. So here is a glimpse of how adrenal fatigue is. So your day starts at 7:30 a.m. So as you hit the snooze button several times before you can muster enough strength to roll out of the bed, you get through your normal morning routine, but feel very tired despite the reasonable amount of sleep that you just had. So maybe you're just telling yourself, I'm not a morning person, which is what we always think about it. So you head down to the coffee shop and you buy yourself a coffee and also a sandwich and head back to your comfy office or even home. So while at work, you finally feel that you are awake. That is around 10 a.m. And once you go through that email and something that needs to be done, but you can't just care less about it. You just think that I don't want to do so much work. It's just giving me so much problem. So it just takes so work goes on, and having a lunch break, sometimes you just feel like skipping your meal and having a few chips because you're having an indigestion problem. So on that time, 3 p.m. hits and you just feel like, oh, I wanted to have a chocolate bar, maybe an energy drink to get through your workday. Okay, so after dinner, you are feeling surprisingly good. So every time you can feel like, oh, when I go back home, I feel much more energetic and much more happier. It's not because of work, it's because of the adrenal symptoms that you have. So you watch a few shows and get into a sleep mode. So it's already 10 p.m. and now you're tired, but something tells you it's not the time yet. So you scroll through your phone and you have been hooked on, and before you know it is already 1 a.m. So you tell yourself, oh well, maybe tomorrow you get it through again. So this will be an endless cycle. So these are the symptoms of adrenal fatigue. Alright, so these are the symptoms of low cortisol. And adrenal fatigue will be a whole new topic, so we will look into the situation for the coming session, and hopefully this can help you understand clearly about what's the stages of adrenal fatigue or even what to expect. So that will be entirely new topic on that. So let's look at the symptoms of low cortisol. So for the next situation is after a long term of stress you've been through and your cortisol level have been depleted throughout both days and nights. If you have more than half of the following symptoms, it is likely that you have already gone through the first two stages and now suffering from adrenal fatigue. So you can also take a screenshot of this. If you have more than half of this, you might have a symptoms of low cortisol. All right, so now the fact is that the best prescriptions for stress relief is not a pill, but rather is a lifestyle changes and coping skill. There are, however, some supplements that can also help the adrenal glands to regain proper functions and balance. But we will see that in the next sessions also. So before moving on to the next topic, I would like to invite one of my dearest friends and also someone who believes in my professional teams to remedy her problem. So let's hear from her on her condition before receiving the treatment and after receiving the treatment. So let me welcome Sharon.
Thank you, Kim. Yeah. Okay, I would like to share. Actually, I have a problem is that I got a thyroid on my left side. Is the tumor grow there, so I need to remove my left thyroid. Since after remove my left thyroid, I have a problem on what hormone imbalance and my metabolism is low. So since I got this problem, I cannot control. One thing is I keep on gaining weight. Okay, I keep on gaining weight. I tried to lose weight. I tried many methods. Okay, but when I lost weight, I will rebound very fast also. And then I can say this is due to stress or my lifestyle. I'm a career woman also. I work. Kim know very well. And I was told Kim that time,
Yeah.
I have a lot of things to do. I say, I don't have time to go for exercise. I say, actually, I know exercise is good. Exercise is good, can? At least exercise, I can. Yeah, I did exercise before. After 3 years, I stopped for another 3 years. I didn't go because I was too busy. But I know my problem. I went and see doctor and I checked. I have a thyroid due to thyroid problem, and my metabolism is very low, so I cannot control my weight. Okay, even I say I gain weight very fast one. Even I eat a little bit, I thought I can feel that I gain weight very fast. I was worried about my health. But for me, when we reach our age 40 and above, we start concerned. Maybe before we will ignore everything, but since we reach that age, we will concern everything. We concern about our health, because we know that we have when we are in a good health, we can do everything. If not in a good health, we cannot do anything. Okay, but I feel very thankful to Kim also, because if there is a solution, another solution is safe. I will try. And just nice, I think it's last year. Yeah, last year Kim told me this kind of solution, and I said, okay, I would like to try that. Before that, I feel very happy because Kim really monitor, really follow up me, okay, and we go through everything. That's I thank you very much, Kim, because through this Plexa 23, really helped me. I lost weight, and then I feel energetic, okay. My hormone balance, everything, and slowly from there, Kim also told me and follow up me and told me what to do, like exercise, what should I take, what should I don't take, in terms of food. This is my sharing, because this Plexa 23 is very good, really helped me. If not, I keep on worry. And when you worry, you're so stressful. And then you cannot understand. But luckily, there's a solution. God really helped me. Yes, really helped me a lot. Okay, this is my sharing. Thank you, Kim.
Thank you so much. Okay. So actually, this is her photo. So before that, she actually is a XL size. That's what she told me before. And then now she actually becoming L size. Yep. So I'm quite happy because from here I can see that she also lost 13 kg in just 30 days. So this program can reduce at least 8 kilograms. So here is her graph of her weight loss journey. So at the first 3 days, I asked her to eat a lot, where you can just hike up your metabolism, because sometimes when you try too much of the weight loss program, right, like maybe you tried apple day, or even you try a different routines of weight loss program, your metabolism will actually be disrupted. So being disrupted, you need to reboot your body system, right, like rebooting your car, same thing. So it's just that you have to just hijack a little. That's why I said, so on the first 3 days you have to eat at least 3,000 calories per day. So when you eat 3,000 calories per day, you will just provide more message to your body saying that, hey, I'm eating so much, you have to increase your metabolism, so your body start to work. So from the first 3 days, it will increase on the metabolism, and from the 4th day onwards, we will provide a specific menu for individual where we cater what they need, and the calorie of course lower than 3,000 because we want to lose weight, right? So from there, every day she can lose at least 1 kilogram to 500 kilograms. That's how effective it is. And by this, I'm not only working alone. I also have a team of doctors that actually taking care of Sharon's journey too. So every day, not only myself, I also have doctor that will monitor your progress every day. So it's really safe. So any problem, you can directly consult doctor immediately. All right. So that's it for cortisol. So next is about this is called Dehydroepiandrosterone. So in the short name is called DHEA. So DHEA is most abundant hormone in the body. So consider that DHEA is a fountain of youth for this steroid hormone. So it's a steroid hormone. DHEA is part of that steroid hormone. So this is synthesized testosterone, estrogen, and progesterone. So if you remember, these three hormones are the sex hormone. And also, it has cardiovascular, metabolic, and anti-stress qualities. That's why I want to talk about cortisol and DHEA together, is because DHEA will help to reduce the high symptoms of cortisol. So here, it also comes from adrenal glands, skin, and also your brain, and actually helps the reverse effect on the stress on immune system while decreasing the excess cortisol level. So when DHEA levels are optimal, it will actually benefit the cardiovascular, where it decreases your cholesterol, it prevents clotting of the blood, and lower triglycerides. And next is your metabolic, where it decreases storage of your fat and promotes weight loss and lean muscle mass, where it increases basal metabolic rate and also increase the insulin sensitivity. lastly, it's also helpful and beneficial to neurological function, which it increases brain function, including your memory, where it helps regulate mood and reduce depression symptoms because it helps to increase serotonin. So this serotonin hormone is actually your mood regulator. So it's a mood regulator where it also prevents anxiety and help you stop food cravings. So lower the perceptions of stress. It also decreases and antagonizes cortisol, improves sleep and protects neuron from injury and degradation. So besides that, DHEA raises the growth hormones levels where it enhances longevity, increases bone formation and density. It also helps promote fertility, helps pregnancy, maintain pregnancy, and reverses vaginal thinning, and improve libido, supports immunity, discourages cancer cells replications, helps treat fibromyalgia, increases skin thickness, prevents dry skin, decreases skin pigmentation. So all these are more to anti-aging and promotes wound healing. So once you see any hormones that is related to human growth hormones, it actually helps in speeding up your recovery and in the same time helps the replications of healthy cells. So it's simple. DHEA helps to raise HGH, and with HGH you will get the anti-aging benefits, and in the same time you can promote healing. So interestingly, DHEA do not have a medium that brings to the gland. So there are no messenger for DHEA and there are no receptor. So researchers currently believe that DHEA functions primarily as a reservoir for the productions of sex hormone. So unlike with other hormones, there are no biological system that senses the supply and demand of DHEA. Therefore, if you are deficient with DHEA, it's because of the stress and or aging. So you will remain so until you take supplemental DHEA or minimize your stress level. But because this substance converts into sex hormone, it is important that you do not supplement yourself with DHEA when it is not truly needed, because as I mentioned just now, it will raise the HGH, where for women, if you take too much of DHEA, it will increase your testosterone level. And if men taking too much DHEA, it will increase estrogen level. So it will lead to hormonal imbalance. So therefore, it is important to recognize the symptoms of both low DHEA and excess DHEA. Alright, so here is it is not clear if DHEA supplementations can improve the disease associated with low DHEA levels. So hormone testing is always the great way to check whether your levels are optimal or not. So if you have more than half of the symptoms or condition on this list, you probably don't make enough DHEA. So again, if you wanted to take a snapshot of it and see whether you are having more than half of the symptoms, you can go ahead. And just to mention, having low DHEA is also related to also like rashes or even psoriasis. All this is because it's related to your immune system too. Okay, so primarily there are two causes of DHEA, which is decrease in DHEA, which is your aging, and it is common to see in the level declines when we are aging by 74%. This is by the research. So, but low levels of DHEA can also result from smoking over a long period of time. So, having this, why smoking can affect the DHEA level is because there is an enzyme. This nicotine can prevent the formation of the enzyme which is needed to make DHEA. So the more you smoke, the more ineffective for your DHEA to be produced. So once it being depletes, then that's it, it's finished. But how you're going to improve your response to stress is that usually what we do, like just now what Sharon said also, is exercise and consume less calorie to jumpstart your natural DHEA production. It sounds simple, but actually it's not that simple because you have to do it in a very, very long period of time. If these methods are not sufficient, DHEA replacement therapy, which is under BHRT, can be put to use. So again, just a small advice is that HRT and BHRT are different. So that will be another topic, but what I'm trying to say is that BHRT in research is actually much safer than HRT. So if you wanted to go to meet doctors and doing a hormone replacement therapy, it's better for you to approach a BHRT approach. Okay, so another one, again, if you have more than half of the symptoms on this list, it is likely that you will have your DHEA levels high. So again, if you wanted to take this photo, just take. And what I'm trying to mention is that, like just now what I mentioned, if you taking DHEA more than what you needed, the first thing that you will see is actually acne. So if you have too much of DHEA, you actually have the side effect of the acne outburst. So usually last time when one of my customers taking DHEA, and they actually have this acne symptoms, like having a breakout. So it actually relates to the supplements that they're taking before, and by reducing it, they actually have a balance on that. So it's very important to know that actually acne is related to high DHEA as well. All right, so how can we reduce DHEA level? So actually, if your DHEA level is found to be naturally high, there are a few things you can do to help lower it. So first is that you need to measure your hormone level. So usually if your estrogen and progesterone found to be low, and by supplementing to restore the balance will help to decrease the excess DHEA. So additionally, cutting down on animal protein in your diet and adding vitamin E in your supplements to your daily regime can help balance DHEA as well. And lastly, if you take supplemental DHEA and find that your levels are high, you obviously need to decrease your dosage. So, but whatever it is, you need to measure your hormone levels accurately and make sure that this dosage is given accurately by your health practitioners. So of course you will know the levels or dosage. So all you can do is monitor what's your reaction after taking the hormone therapy. So if you need further recommendation about the test, you can simply just inquire me through the email, or I can arrange your appointment or test to your comfort of your home. So I will explain to you what's the test. So in the first session, I did mention about the types of tests, but in Malaysia, saliva test is the most popular alternative and the most accurate test that you can ever do. So this saliva test, as mentioned, is the better accuracy compared to blood tests. However, cortisol can be tested with blood tests, but cortisol you need to do fasting. So if you do fasting, you can check what's your morning cortisol like, and also know what's your blood sugar is, because that's also related. Then after that, for saliva also you need to fast for about 12 hours without brushing your teeth, and you need to collect your saliva sample in a bottle that we provide for you, and we can process from there. So it's non-invasive at all. So you can just collect a sample of your saliva and send it to us, and we will send it to the lab and process it. So the turnover time for this is actually 14 days. So after 14 days, you will get a report like this. So all this information is, you will have a result, a range for this. So it is directly a number here. It's not a range saying that you're over or lower. So it's just saying that this is your number for your hormones. However, in blood test, it will just say that, oh, you are more than this or you are lower than this. So there is no accuracy on that. And this is the one of the DHEA case study. Is that how they usually use on DHEA is that usually they would take 35 grams to 50 grams daily, and taking 35 grams for 2 years period and 50 milligram for up to a safe dosage plan per research study. This is what they do. So you have to, that's why I coded, you need to advise with your doctor about DHEA consumption, because it might lead to hormonal imbalance if you take too much. So due to complexity of the DHEA structure, supplements can cause various reactions when taken alongside with other medication. So if you're taking high blood pressure medications, or even you're taking cholesterol medications, you have to consult your doctor before taking DHEA hormone treatments. So the potentials of DHEA side effects are commonly reported is that you might have oily skin and acne. That's why I said that's the first thing that you will find out, as well as your skin thickening. So you might have hair loss, stomach upset, changes in menstrual cycle because of your increase of testosterone. Therefore, your menstrual cycle will having problems on that, and you have facial hair. So you might see some women, they might have facial hair here. So mostly is that their testosterones are high. So if you have high testosterone, your facial hairs are very visible. And deepening voice of women, and fatigue, nasal congestion, headache, and rapid or irregular heartbeat. So all these are the symptoms of actually is high DHEA level. Sorry, yeah. So this is the end of our session today. So thank you for your participation. And if you need any more information about this topic today, you can just list down in the group chat, or even in you can just email me. So our next session will be on estrogen. So estrogen, I will just touch on what is estrogen and what is E1, E2, and E3 specifically on that, and how it's related to breast cancer. So I will do it on the 2nd March, 7:30 p.m. And please follow our page so that you can get more information on that. And if you have any questions that you want to ask, you can just contact me directly on the WhatsApp or even through email. So thank you everyone for listening, and hope that you can understand this topic today. So thank you. And if you have any question, you can just unmute yourself now and ask if you want to. So I have ended today. Thank you.
Thank you, Kim.
Thank you.